Okay, we are back. And again, I want to apologize for the technical difficulties. Many of you on here have heard the introduction of Dr. Nicolas. I'm going to continue to move on so we have time for you to hear from these brilliant ladies moving forward. The next individual that I want to introduce is Jamarah Amani. She is a community midwife who believes in transformative and healing power of birth and that every baby has a human right to human milk. Her mission has to do her part to build a movement for birth justice locally, nationally, and globally. She is a birth worker and a miracle worker, honestly. I know her personally. She started the birth justice movement and is the founder of National Black Midwives Alliance, the only national professional association specifically for midwives of African descent. She is a trailblazer, an award winner, and I love her so much, and we're so blessed to have her here with us today. So with that being said, we are going to hear from our panelists approximately 10 minutes each since we ran out of a little bit of time with the technical difficulty. And then at the end, we're going to have about 15 minutes for question and answer. So you see the chat on the side of the screen. Any questions that you may have, please put those there so we can get those answers for you. So Dr. Nicolas, I guess for 10 or so minutes, I want to ask you first, given your research and professional experience and observation, how would you describe how implicit bias manifests itself in the medical and mental health field, even in places as diverse as Miami?
Well, thank you so much. And first of all, let me just say a huge congratulations to the Catalyst family for hosting this summit again, for the opportunity to integrate such diverse topics in a topic that's talking about poverty, because there's a recognition that addressing these things are crucial if we are to have a holistic, comprehensive way of addressing poverty in our communities and in this country, to be specific. So I really have had an opportunity to follow on with some of the sessions that took place over the last couple of days. And so implicit bias as the theme has been like permeating to a number of different conversations. But for those of us who are here today who may not have had an opportunity to hear those, so we think about implicit bias. I always think of like, how am I going to explain this to like my grandmother, right? So we're talking about these unconscious prejudices that people might feel about somebody, a thing, or person, right? So they are unconscious, which is important. But the word implicit bias is not unique to healthcare, right? So it applies to lots of different places. So we're talking about involuntary, often refers to as both either positive or negative attitudes and stereotypes that can affect the actions of individuals without them knowing it, right? So that the person is, so we often use other ways to talk about that. So we can talk about implicit social cognition, that you might hear people talk about that. But whatever they're referring to, they're still talking about these attitudes and stereotypes that affects our understanding, our actions, and our decisions in an unconscious way. This is what makes it so important for us to have the conversation, because we're talking about these things, these beliefs and attitudes that we have that are unconscious, but they affect our understanding of other people. They affect our actions vis-a-vis other people and the decisions that we make vis-a-vis other people, right? So in terms of, and I know our time is really short, so it encompasses, because of the way we're talking about and thinking about implicit bias, then you would expect that it really is something that we can see in a variety of different settings. And so clearly health being really, really one of them. So how does that show up? How does it show up? And how are some of the ways that people might talk about that you can see that implicit bias is like well and alive and in existence, right? So it shapes the way that providers are interacting with their patients, right? So what does that mean? So if in fact, I, as a Black woman, show up at my doctor's office and my doctor's office has some attitudes and beliefs about who I am that they're not aware of, then they may interact with me just like I'm talking now. Because people say, well, why are Black people so loud? It's like, you see, that's like an implicit bias. Because I'm talking this way, it may seem like I have like some anger issue, when in fact I don't have any anger issue. And the way that they're gonna interact with me is gonna look differently than they would have interacted with somebody else because of their attitudes and their perceptions of who I am, and they may not even be aware of that, right? So the interaction between the provider and the client becomes really, really salient in terms of one way that this thing could show up. Another way that it can also show up is in the space that we have. So the way that you structure your space, I don't know if many of you who are like now watching this summit, I don't know if you've ever seen like a beautiful brochure about a vacation spot or a spa place. And then you look at the brochure and you're like, there's nothing of it that looks like you. Like it, right? So it's like, how did somebody decided to create a wellness place where you can go get a massage, but they never thought about the fact that people that look at different skin tone or different racial group could actually be coming to that? How did that happen? And that also happened in the settings as well, that you show up in a setting and the person didn't think, there's like no conscious awareness that there are different people here in Miami that actually may want to come to this place because the setting does not lend itself to that. When you show up, it does not send the invitation that you matter in this particular place as well. So in addition to that, let me just give you a quick example before Armen tell me my time is up, right? So I had an opportunity when I first moved here to Miami, and I'm looking for providers, and somebody said, I have the perfect dentist for you. Like this, like Andre is perfect. Andre Gonzalez is a perfect dentist. He's wonderful, he's perfect. When I got to see Andre, I was surprised. He was absolutely fantastic and wonderful. But when I got to see him, I realized that the only way I can get to go see Andre is that I had to take the step. I had to take a step, 2 flights of steps to get to the second floor to go see him. And I don't mind taking the steps because I want to take the step as a way of keeping myself physical fit. But then I had to start asking myself, is that the only way I can get to see Andre? Turns out that there's no elevator in the building. How is there a professional building where the best dentist is housed, but there are no elevators in the building for others to get to? So like how, like that's an unconscious, right? Somebody who didn't think that maybe somebody in a wheelchair may need to go see the best dentist up there. And the fact that there is no elevator, which violated some, federal laws as well. Okay, we're gonna leave that for a moment. But how does that not permeate in the person's mind about the importance of ensuring that you're absolutely addressing some of these things? So when you bring it up, so when I say that to Andre as the dentist, he's like, you know what? It never occurred to me. It never occurred to me. So there you go with the implicit bias, or these things that are unconscious that the person is engaging into, that they may not necessarily even be aware that they are happening.
Right.
And we're seeing them throughout. So when I can go to if I can see the best cancer center here in Miami, and then when I say I want to send the Haitian person to you, and you say to me, I don't have a Haitian provider, the stuff that we have is not translated in Haitian Creole, and we don't have a nurse that can be able to do all of that. To me, that is an example of implicit biases. And right here in Miami, where we have a large Haitian community, and you saying to me that we never thought about the idea that we may need to include, Haitians in our RB study, because all of that has implications for us addressing health disparity as a country, right, and as a community.
Okay. Wonderful. Thank you for those examples. Jamarah, you work in the birthing justice space. How does implicit bias show up in your field?
Can you hear me?
I can hear you, yeah.
Awesome. Well, it shows up in a lot of ways. We know that Black birthing people are 3 to 4 times as likely to die as a result of pregnancy-related causes, and the numbers for morbidity are even higher than that. And a lot of that has to do with implicit bias. It has to do with discrimination that is baked into the institutions of this country. Institutionalized racism is real in hospitals, in clinics, in doctors' offices, and pretty much anywhere a pregnant person might go to access care. Not to mention what they experience in their workplace and in their community. And we cannot understate the role of state violence. I like to uplift the names of Black women who have been murdered by the police. And the one that comes to mind right now is Charlene Lyles. She was murdered a couple years ago by the police in Seattle, and she was pregnant, and she was a mother of 5. So, you know, we cannot underscore enough the role of state violence as it comes to, and the implicit bias of police when it comes to the safety and health of Black pregnant and birthing people as well. And, you know, to combat this, it's an intersectional response because the experience is intersectional. I experienced discrimination as a woman, as a Black person. And, you know, if someone is queer or trans, they're going to experience discrimination in that way. If they're poor, you know, they're going to have another level of impact. If they're disabled, as Dr. Nicolas mentioned, they're going to have another level of impact. So all of these things, you know, what we call the social determinants of health, really do cause, you know, these health disparities that we see. And at Southern Birth Justice Network, we talk about health disparities, and we talk about the roots of them, because oftentimes when we see these mainstream discussions, we see these headlines, Black women are dying, Black babies are dying, and it's like, oh, they're dying because they're Black, or they're dying because they're poor. And that's not the entirety of the truth, right? Race is not the cause of health disparities. Racism is. Health disparities are truly power disparities. And although the disparities of maternal mortality and infant mortality are impacted by someone's you know, income and access to resources, we also see that Black folks who are educated, who live in what we would call the good communities, you know, who have access to what we would consider the best healthcare, are still experiencing high rates of mortality and morbidity. And there was a study that showed that even a white woman who has dropped out of high school has better birth outcomes than a Black woman with an advanced degree. And so that tells you a lot, that it's not just about poverty, although poverty is a part of it, because when you don't have access to care, then, you know, you are much more likely to not have your pre-existing health conditions addressed, and not have access to quality care, et cetera, et cetera. But even the case when we think, I think about Kira Johnson, and I call names because I think it's important to say her name, right? It's important to remember those who have left us and who have been murdered by the system. So I call the name of Kira Johnson, who was a woman who gave birth in a hospital, I believe it was Cedars-Sinai Hospital in LA, considered one of the best in the country, and was basically ignored after having a surgical birth, a C-section, was basically ignored by hospital staff for 10 hours while she bled out internally, while her husband went and begged the staff to come because he says something's wrong. This is not okay. His wife was feeling weak and you know, having pain and having, you know, symptoms that would not be normal after a healthy birth. And for 10 hours, they allowed her to bleed out internally. By the time they did an ultrasound, saw that her body cavity was full of blood, and got her into the operating room, it was too late and she died on the operating table. That should never happen anywhere. It should certainly never happen in the United States of America, where we spend the most money per capita than any other nation on healthcare. We have all these doctors that, you know so much, but know so little about holistic care, about listening to people, about, you know, how to care for Black and brown communities. Yeah, about the history of institutionalized racism and how medical experimentation and abuse has happened to Black people since the beginnings of this country. In fact, the foundations of gynecology are based on abuse. The so-called, you know, who they call the father of gynecology, I refuse to call him that, J. Marion Sims, he founded a lot of the tools that we use today in obstetric care are based on torture of enslaved Black women. I call the names of Anarcha, Betsy, and Lucy, who were the names of 3 Black women that he experimented on without anesthesia, even though it was available, and did, you know, on one particular woman, almost 40 procedures, just because he was interested as a scientist and curious. And white people's fascination and curiosity about Black people has actually fueled a lot of medical research, and we cannot separate that from the current context of care. People like to talk about that as the past, but we cannot separate that from the current context of care because it bleeds through. It affects people's biases. There was a study done just a couple of years ago, University of Michigan, about medical students and how their perception is that Black people don't feel pain or don't feel pain as much as white people. And so the foundations of white supremacy are, you know, through and through the medical system. It's in the training, it's in, you know, the staffing, it's in the, you know, the policies, the way that people's rights are taken away when they sign on the dotted line upon admission to hospitals. And so I'm not trying to demonize doctors or nurses or hospitals, but I do think that in order to transform the system, we have to look at the roots of what's happening and the deficiencies in the way that people are trained to, you know, dehumanize and dehumanize particularly marginalized people. And the people that get the brunt of that, as with anything in this country, are Black and Indigenous people.
Right. Okay. Thank you. Thank you
I can
so
keep
much.
going if you want me to. I got
brought
more.
up. No, we want to have this dialogue back and forth, and I appreciate the candidness of both of your responses. You know, with that said, you know, we talk about implicit bias in the medical field, and honestly, that's just like the tip of the iceberg. Because it's going to lead into my next question. I wish I could share my screen, but basically, I have this chart that talks about its levels to racism and implicit and bias in medicine. There is the interpersonal level, and in the interpersonal level, that's really where you have the implicit bias. But then there's before I get to, you know, what role government can play, you know, what do you think?
Can you repeat that again, because you went in?
What do you think happens once people identify that they have implicit bias? Excuse me?
Sorry, can you repeat those stats again, because you went in and out? Yeah, can you just? Yeah,
okay. Well, no, it wasn't stats. I was just saying that it's levels to racism, and implicit bias is just one tip of the iceberg. Like it's like the bottom rung of the level. There's interpersonal, intrapersonal, there's institutional, there's community, and then there's systemic racism. And so, you know, when we talk about what individuals can do from the implicit bias level, once they identify that they have the implicit bias, what do you think people should do with that information?
So here's the thing for me, and about this is that we're talking about individuals who are the holder of the issue, but then they don't have access to the fact that they are the holder of the issue. Let me repeat that again. The implicit bias exists within the person who is engaged in the structure of racism in the society, but the person is not aware of the fact that they are engaging and participating in the system. So we have to be real on that, because we're making it our job to help the person become aware of a thing that they are a part of, that they are the product of, that they are within themselves, right? So that's for me as a psychologist. So it's one thing for you to say, let me make that conscious, let me bring that to your consciousness, right? And so forth, which is what implicit bias institutes are doing. You can go and take the implicit bias test, and it really helps you really get to that particular level, which is great. The question is, like, because we're talking about something that is systemic also, right? And people are made up of systems, is what are the systemic ways of addressing this particular situation? Let me give you an example of what I'm talking about. Let's say Catalyst for Miami was interested in doing some implicit bias training because they recognize the importance of that, given the fact that they are serving a diverse community, right? Guerda comes in as an expert to do implicit bias training. I come in and I meet with the staff, which I can do, to do implicit bias training. They get the test, we do some training, we do some cultural awareness, which is what all the literature says that we're able to do, right? So the question is, like, 3 months later, half of the staff of Catalyst Miami leaves. A whole set of new ones come in again. right? So what are the structural ways that we're actually addressing some of these issues? That's one of the reasons why I said it's not enough to just do cultural competency training, which is the way that people have really tried to address this issue. The question is like how, from an organizational perspective, from a structural perspective, I'm talking mission, vision, your strategic plan, your programming, everything you do, how you think, like that needs to be at the every fabric of what you do. If all I'm doing is saying, let's just do some training, that's not enough for sustainable change.
That's the easy way out, right?
That's the easy way. Like, we all can do that. The hard work is when you have to go into the scraping, and the scraping that you have to do to remove this layer of paint, repaint it. It may need that you're actually going to remove like plywood and put brick. That's the hard work. And to me, the fact that here we are having a summit on poverty, that this is not our first, our second, or our third. And when you look at the United States and our communities here, our poverty rate continues to be an issue. It means that what we have done is to provide that level of layering, is to do what we need to do at that level, but we haven't gone to the deep level yet to begin to scrape the things that we need to do to focus on this particular issue, because get ourselves into poverty maintenance, right? So that we don't get ourselves and see people in this community as if they are a source of charity, right? But that we are focusing on progression in development. And so for us to get a progression in development, we got to start scraping, Armen and Jamarah. We need to get our like shovels, like, to be able to do this work beyond what everything you read in the literature will say. Good cultural training is where you need to start. That's just the surface of all of this.
Okay, great.
I love that.
I want to take that point about scraping, Jamarah, scraping and starting all over again. What would the birthing justice space look like if we just said we got to start off?
Well, that's interesting. Well, first I want to say I love you, Dr. Nicolas. I don't know you, but I love you because I love that the way that you address that, and how and that's really the idea of being radical, of being progressive, is to dive into the roots of something, and not just deal with the surface. Like if we're talking about poverty and solutions for poverty, we have to talk about capitalism. We need to talk about the roots of it. We got to talk about capitalism. There's just no way around that. And so when I think about birth and pregnancy and birth justice, what it would mean to go to the roots of it is to start with the young people. And we would be doing comprehensive sex education in preschool. We would be, removing the stigma around our bodies and bodily autonomy, and making sure that everyone feels like they have the ownership of their bodies, because that's part of what happens when you walk into a big medical institution or a hospital. You feel like you don't own your body anymore. And I've had hundreds of women and birthing people tell me this, that you walk into this institution and your body isn't your own anymore. And so we have to understand that you never have to surrender your body to the system, and that we own ourselves. So that to me is where it would begin, is with young people feeling ownership over their own bodies and feeling that they have the right to access the best level of care for their human body, the temple that has been entrusted to them. And the next step would be that all institutions would be responsive of that. We are at Southern Birth Justice right now, we are pushing the Miami Birth Justice Initiative, which is really a call to action in the Jackson Hospital system, that they adopt policies in labor and delivery that are based in birth justice. And if you go to our website, southernbirthjustice.org, and click on Birth Justice Bill of Rights, you will see the 22 rights that we have outlined that all birthing people have. And that goes from everything to right to culturally appropriate care, culturally centered care. That goes to the right to have a doula, the right to know all of your birth options, right? So if we were to go to the roots of this, it would mean that home birth and birthing in a birth center and hospital are on equal footing, and that anyone can choose, where they want to birth, regardless of race, income, et cetera, and that there would be enough providers of all of these different types of care that it wouldn't be a scarcity issue. It wouldn't be an access issue. It would mean that you can get the care that you deserve in your language. It would mean that, transforming the system would mean that your family is respected regardless of its structure. Your values are centered, including your value to, or your right to make healthcare decisions that you feel are best for you, even if they disagree with your care providers. As long as you are informed and you know the potential consequences of the health, option that you are choosing, then you have the right to make that decision. And too often people are not treated as partners in their healthcare. They are treated as the subjects of healthcare. They're not told what medications they're being given. They're not told, what care options are actually available to them. I always tell people, make sure you ask, what are all my options? Because oftentimes they'll just tell you what they think the best option is. But in a truly birth justice centered healthcare, experience, you would know all of the options available to you. You would be able to trust that your care providers are actually putting your best interest first and not theirs. The institutional racism of, the hospital or wherever you're receiving care would have been addressed from, as Dr. Nicolas said, from the top level to from the CEO to the janitor, all of those policy issues would be addressed. And people would, understand their own health, would have access to their health records in language that they can understand, in language they speak or read, and feel like all of their identities are cared for in a comprehensive way, and that they get support in everything from, stress management to healthy nutrition, transportation, childcare, and they have the time to spend with their healthcare providers. I think one of the big differences between midwifery care and OB care is that people will come to me, they'll transfer to me as a midwife, and they'll say, I didn't like how rushed I felt in my doctor's appointments. I didn't have the time to ask questions. So I will book an hour with my clients, and we'll sit there in silence if we need to, or we'll sit there and I'll ask them a question. What's been on your mind the last week? How have you really been feeling? What's going on with your support system and your how are you doing spiritually and emotionally? Those are questions that people are not often asked by their healthcare providers, but in a truly inclusive, birth justice centered system, that would be standard. And I feel like with birth justice doula care, birth justice midwifery care, and the community medic trainings that you and I have been doing in the community, Armen, that we are really trying to arm people with those tools for healing, so that we're not just, providing medical care or, just caring for someone's body, but caring for them as a whole person. And that's what's really missing from our healthcare system.
Okay. Dr. Nicolas, with that being said, Jamarah focused on the hyper, but from your perspective, from the state and from the federal level, how can we have a system that's more inclusive of individuals from all walks of life, free of capitalism, basically, since we identified that as one of the core problems in poverty? Tell me about that. What kind of policies does that look like?
Well, so I think, unfortunately, representation matters. I don't think we can leave this one to chance. I think that we have to be really, really alert about who is it that we are sending to go represent us. This is a society that is decided by policies and policy makers, and those policy makers are voted in to office, and they are voted by individuals. Oftentimes, we're not asking for people's perspective. I don't know the last time I heard an elected official saying, this is my position when it comes to birthing of women in this country, or even the stats about what does it mean for you to be a Black woman in this particular society. So I think we have to be very mindful of who are the people making decision about my body, about my health, about my right, and so and so forth, both at the federal level, I'm talking about Washington level, at the state level, and then at the county level and local level as well, because that matters. And many of us, I'm talking for me as an academic, we may not always be in the know when it comes to policy. I'd say we all need to have a policy app. I should know exactly how my politicians are voting on all of these things as well. Because remember, we're talking about implicit bias, which are attitudes and beliefs and thoughts that people have that they don't know about. So when they show up to draft up a bill, they don't have me in mind, because not their fault, because that's what we said. It's not your fault because it's unconscious, right? It's not something you have access to. And because the person doesn't have access to it, it means they're not already sitting there thinking of, how do I ensure that people have, healthcare, right? How do I make sure that they have access to healthcare? So I think that we really have to pay attention to the people that we are electing, in our offices, the ways that they go and represent. I want a report card. I mean, I'm telling you, I want a report card back to me that tells me what is it that you are doing and how you are addressing these particular issues, because enough is enough. It is 2021, and here we are talking about poverty in the richest country in the world. And right, the richest country in the world, that's what we tell everybody, the richest country in the world, but we're talking about poverty, which tells us this is a structural issue that requires a structural intervention, right? And so while we can talk about the individual person and what they need to do, I as an individual and how I'm going to address this issue, we need to have a collective revolution that says we will not, do this way anymore, right? Because we've become almost comfortable with inequity. We've become comfortable with inequity. So the question is, like, how do we get around that? To me, I really, because of the society in which I'm in, where the power the power structure is at how we vote and who gets to make those decisions and so forth. To me, that's a really important point. The last two things I'll say, and that is, we're talking about like implicit bias in the medical field. It means, Armen, Henderson should not be a 10% class of physicians getting a degree, because we recognize representation matters, right? So if that's the case, then medical school is going to have lots of Dr. Hendersons, right? That is ready to be able to do that community work. And when you go and do that, you're not going to have a debt of $500,000, which means
$600,000.
Okay, 600,000. Here you go. Then you can't go serve the people that you actually work with to be able to do that work with, because you have to pay that debt, right? That's a structural problem that takes Dr. Henderson in the community in which he would love to serve, but he can't because his degree cost him so much, right? And because of that, there's only 10% of Dr. Hendersons who are actually going into medical school this year.
4%.
Okay,
Yep.
4%. Okay, thank you, Doctor. I was trying to be optimistic today. It's Friday. Okay. Yeah, right?
You got it. You get it.
But here's what I'm saying is, like, so you see how that's a structural issue? That's a structural issue that has a funding component to it, that has a representation component to it, and that has nothing to do with what's happening in Washington yet. Right? So there are some things that we have to do, and we have to stop letting people be comfortable with the inequity. We have to make people uncomfortable. It's not okay to just invite me to the table to engage in this conversation. We have got to be able to say, I am willing, I'm willing to step up and get on the street and actually demand differently. Right? Enough is enough.
I like that. And I'm going to open this up to either of you. Jamarah, you can chime in if you want as well. We live in Miami. We talked about the federal level and we talked about the state level. Now let's bring it back down to Miami. When you start introducing some of the policies that we want to see, like healthcare for all and justice for all, et cetera, we get a lot of pushback from our Hispanic brothers and sisters, particularly the sentiments among our brothers and sisters who are from other systems and fight against the things that we feel like we need.
So
Did you get that?
Your audio broke up a little bit, but I was hearing you say that we get some pushback from our Hispanic brothers and sisters and who are
Yes.
maybe used to different systems or.
Yeah, and that when you try to offer these solutions that are blanketed, like healthcare for all, et cetera, or try to introduce them, they're called socialism, and automatically they're blocked. Even though these are the things that we actually need access to lead healthier lives, especially in a place where we spend so much money on things like healthcare. So how do we push back against those sentiments?
Well, I think it's a values conversation. I think that's a great question, Armen. And I think particularly as Black people in South Florida, we have to really talk about how institutional racism and colonialism and the intertwined histories of Black and Hispanic people, Latinx people, and let's not invisibilize Afro-Latinx people, right? Who are often left out of the conversation and who are, biracial and in both worlds, are really impacting the current way that things operate in Miami. The power structures are not by accident. They're very political. They were designed to really institutionalize white supremacy in a way that it could be, it could separate, Indigenous, Latinx, and Black people from each other. When actually there is a lot of overlap and, common ground that we could all be on. And so I think that one of the things that really gets confused is identity. And people really separate themselves by these, racial categories, which were basically given to us. It's very easy for somebody who may have been considered, or maybe their grandmother was indigenous, to come to Florida and be first, second, or third generation and be checking the white box. And I think we have to address the way that white supremacy shows up in how people choose to self-identify and the benefits of, I was just reading an article about the benefits about like what happened with the election with the Latinx community and how there's a perceived benefit of being in proximity to whiteness. And that is embedded in the institutions, not just in Miami, but we see it in Miami. It's so stark because of the very strong Caribbean and South American populations here. And we just did a series on this at Southern Birth Justice Network called Enfrentándonos. And we talked about how do we decolonize race, and particularly how Afro-Latinx people confront and decolonize race, and the way that colonialism and those legacies that exist, in the islands and in the South America, really in Central America too, really carry forward, when folks come to this country and create communities that are very insular and where the messaging is very stereotypical across racial lines. And really the foundation and the culprit of that is white supremacy, and that's who benefits from it, is, the 1%. And so, which is, 99% white. So we have to really address race from its foundations and call it out and have deeper conversations about identity. I love when people tell me they're white and I'm looking at them being the same color as me. And I'm like, well, where your grandma from? Where your people from? Because yes, while, I may have some European ancestry and other people may too, it is really easy to hide the Blackness. There's a whole syndrome in the Latinx community called the Black grandmother in the closet. I don't know if you've ever heard of it, but it's this idea, and this thing that really happens in families where, if your grandma was dark, you don't pull out those family pictures and you try to whiten up the race generation by generation. And if we're going to think that that only happens in families and doesn't happen in institutions and doesn't impact health equity, we are fooling ourselves, because those same people, when they come into positions of power, really enact policies that do the same thing. that hide the Black grandmother in the closet, that don't give the Black
Mhm.
grandmother the care that she deserves and the honor
So-
that she deserves. And so that's where we have to address it. I think these deeper conversations about race and colonization and about how do we decolonize our identities opens up a whole piece that I don't really see a lot in Miami. I don't really see people having these conversations in any kind of large scale, certainly not in schools. When I moved to Miami about 12 years ago, I spent 2 years trying to chase down the Black history of Miami, you know, and I'm like, there's Black people everywhere. Why aren't they teaching this history in the schools to my children? Why isn't it very prominent in the libraries? You know, why can't we go past Martin Luther King and Rosa Parks and Harriet Tubman, wonderful, amazing, you know, revolutionary ancestors? And there's so much more right here in Miami. And most people don't know that Fisher Island used to be owned by a Black man, for example. You know, the richest zip code in the United States, Fisher Island was owned by a Black man. And why isn't that taught? Why isn't, you know, the history of the Haitian people who were the, you know, basically the Black warriors of this region? Why isn't that taught? And if we can get to that point where we can center the identity and the history of Blackness, then, you know, we can address a lot of different things.
Okay, thank you so much. We have 2 minutes. Dr. Nicolas, any closing thoughts that you have, and then I'm going to close us out. Tell us what's on your mind. 2 minutes, go.
Well, 2 minutes. What's in my mind right now is that poverty is a systemic issue. It's not an individual issue, and if it isn't a systemic issue, we need to address it systemically. And when we focus on this issue about implicit bias, then we get at it as if it is an individual person that we need to really get at, right? And so we need to start thinking about implicit bias as a systemic structural thing. And so how do we address it at its core? And what are the tools that we need to actually scrape? The scraping tools we need, we may not know them yet, but we need some scraping tools to really get at this in this particularly for us here in Miami. If we are serious and if we are focusing on solutions, the next poverty summit that we will be having, that summit will be celebrating. Let us show you the successes of what is it that we've accomplished because we put our working clothes on and we got the tools together to really address this in the way that we need to do. So without doing so, you and I, Jamarah, and we'll be back here in another summit and we'll be talking about the exact same issues and so forth again. And for that one, I won't be showing up. Let me just be very clear.
Okay.
I'm showing up on the things that is addressing the systemic issues.
Great. You know, I want to thank you two wonderful ladies for talking with me today. I hope our attendees got a lot out of this. Jamarah, Dr. Nicolas, we're so appreciative to have you. You know, with that said, we have 1 minute. Scrape the pot. We gotta. We at the top of the soup jamu. We gotta get down to the bottom when it's all gone. Scrape it. We gotta scrape it off. So with
that good
said,
stuff at the bottom of the gumbo pot.
You gotta get it. That's the good stuff. Yeah.
Yep.
So I'm supposed to say that tomorrow we're supposed to join the health equity session tomorrow at 1 p.m. to learn about opportunities to get involved and take action. Because we're not going to get out of this by just sitting back and talking about it. We gotta take action steps and move forward accordingly. So thank you again. I look forward to talking with you two ladies soon, and great conversation.
Thank you so much.
Thank you, Armen. You're awesome.
All right. Yeah.
Yes.
Thank
Love you.
Thank you, everyone
Thank
that
you.
attended.
Yes, good to see
Thanks,
everyone.
y'all.